students, how are you all? I hope you all are doing well. In our today's video, we are going to study semi-solid dosage form. So let's begin with our today's video. So students, starting with introduction, semi-solid dosage forms, as the name itself indicate, it consists of both solid as well as liquid, right? This type of dosage forms are viscous in nature and normally they are used for topical or external application. Then, semi-solid dosage forms are usually intended for localized drug delivery. However, in the past few years, this form also have been explored for systemic delivery of various drugs. Semi-solid constitute a significant proportion of pharmaceutical dosage forms. They are having major application in cosmetics. They can be applied topically to the skin, cornea, rectal tissues, nasal mucosa, vagina, buccal tissue, urethral membrane, external ear lining, etc. Right? Then, talking about definition of semi-solid dosage form. So, semi-solid dosage forms are dermatological preparations intended to apply externally on the skin to produce local or systemic effect. Semi-solid dosage forms can also be defined as dermatological products of semi-solid consistency which are applied to skin or mucosa membrane for therapeutic or protective action or cosmetic functions. Then, pharmaceutical semi-solid preparations may be defined as topical products intended for application on the skin or accessible mucous membranes to provide localized and sometimes systemic effect at the site of application or for cosmetic functions. Examples are ointments, cream, paste, gels, etc. Now, moving to advantages of semi-solid dosage form. So students, it is used externally, then the probability of side effect can be reduced. The next is first pass gut and hepatic metabolism is avoided. Then localized action and site specific action of the drug on the affected area can be achieved. Then it is convenient for unconscious patient or patient who have difficulty in oral administration. It is suitable for bitter drugs. Then it is more stable in comparison to that of liquid dosage forms. Now moving to disadvantages. So disadvantages of semi-solid dosage forms are the accuracy can't be measured for the semi-solid dosage forms. They cause staining. Next is they are bulky to handle. Then application with a finger may cause contamination. Then physicochemical is less stable than solid dosage forms. It may cause irritations or allergy to some patients. So these were the disadvantages of semi-solid dosage form. Now moving to next one, that is the ideal properties. So first one we'll be seeing its physical properties. So basically semi-solid dosage form should have smooth texture, elegant in appearance, then they should be non-dehydrating, non-gritty, non-greasy and non-staining, as well as they should be non-hydroscopic. Let's move to their physiological properties. So they should be non-irritating and they should not alter functioning of membrane or skin. Then they should be miscible with skin secretions. Now talking about their application properties. So they should be easily applicable with efficient drug release and high aqueous wash ability, right? Ability. That is, they should be easily washable with water. Then moving to next one, that is classification. So students, Semisolid dosage forms can be classified as ointment, cream, paste, gels, as well as jellies, right? Then plasters and suppositories. They can also be classified based on their use, right? That is semi-solid dosage form which is used for external use and the one which is used for internal use. So for external use we have ointments, paste and suppositories, and for internal use gels and jellies, right? So ointments again based on the basis, that is the oligogenous base, absorption base, right, emulsion, water washable base, etc. Now, moving next, that is excipients that are used in formulation of semi-solid dosage form. So basically, the excipients that are included are bases, preservatives, humectants, antioxidants, emulsifiers, gelling agents, then penetration, sorry, permeation enhancers, buffers, and organoleptic agents. Now we'll be seeing all of these one by one. So let's start with bases. So students, it is one of the most important ingredient that is used in the formulation of semi-solid dosage form. Bases do not merely act as carrier of medicament, but they also control the extent of absorption of medicament incorporated in them. Ideal properties of bases are they should be inert, non-irritating and non-sensitizing. Then they should be compatible with skin pH and the drug. They should be a good solvent and or emulsifying agent. Then they should provide emollient and protective property, as well as they should be non-greasy and easily removable. Then they should release medicament readily at the site of application, and pharmaceutically elegant and possess good stability. So these are the ideal properties of the bases, right? So it is expected that bases should fulfill this criteria. Then moving further, according to USP, ointment bases are classified into four general groups. The first one is hydrocarbon bases, that is the like that of the petroleums. Then absorption bases. The next one is water removable bases, that is oil in water, and water soluble bases. Okay. Then the next is preservatives. So students, preservatives are used to stop microbial growth. These preservatives prevent and inhibit the growth of microorganisms in the preparation, right? See here, ointment includes para hydroxybenzoids, phenol, benzoic acid, sorbic acid, methylparaben, propylparaben, then quaternary ammonium compounds, mercury compounds, etc. as preservatives. These preservatives should not react with any of the component of the formulation. Okay, they are supposed or they are needed to be inert. Okay, then plastic containers may absorb the preservative and thereby decreasing the concentration of preservative available for killing the bacteria. Therefore, one has to be very careful even while selecting the packaging material for the product. Getting? Now, the next is humectants. So students, the humectant is a hygroscopic substance used to increase the solubility of the active ingredient, increase skin penetration, and it also used to improve the hydration of the skin. The moisture loss from the preparation can be reduced, can be prevented by using the humectants such as glycerin, then propylene glycol and sorbitol. Getting? Now, the next ingredient is antioxidants. So students, oxidation can occur with certain ingredients such as wool fat and wool alcohols. Oxygen has the capacity to become a part of potentially damaging molecules called free radicals. Free radicals can attack the healthy cells of the body. It can break their structure, and that's why the functioning is also affected or altered. Therefore, antioxidants are incorporated to guard against oxidation and preserve the effectiveness of the active ingredients. The examples of antioxidants include vitamin C, vitamin E, carotenoids, etc. Then the next is emulsifiers. So students, emulsifiers are used to improve the stability of an emulsion by increasing its kinetic stability. It reduces surface tension and prevents coalescence. Then it helps to increase the viscosity at low concentration. Emulsifying agents used in semisolid dosage form are first one, that is glyceryl monostearate. It is a weak water in oil emulsifying agent and it is used as a stabilizer and emollient in the oil in water emulsions. Then the next is examples of oil in water emulsions such as sodium stearate and calcium stearate. Then polysorbate, then anionic emulsifying agents, etc. are also added when required. Moving to next one, that is gelling agents. So students, gelling agent functions as a stabilizer and thickeners to to provide thickness without stiffness. Then examples of gelling agents are tragacanth, pectin, starch, carbomers, sodium alginate, gelatin, then cellulose derivatives, polyvinyl alcohol, clays, etc. The next ingredient included is permeation enhancers. So students, skin act as barrier for most of the semi-solid preparations. Therefore, skin should be permeated is the basic role of these permeation enhancers. So skin hydration, temperature and pH are most important factors affecting permeation from skin. These are there are various permeation enhancer that can help the drug to penetrate through the skin. Example of such permeation or penetration enhancers are first one oleic acid, EDTA, salicylic acid, etc. Now moving to next agent, that is buffers. So student, as you already know that buffer is a solution that can resist pH change upon the addition of an acidic or basic components, right? Buffers are added for various purposes such as for enhancing compatibility with skin, drug solubility, drug stability, and influence the ionization of drugs. Commonly used buffers are sodium bicarbonate, citric acid, etc. Now moving to the last one, that is the organoleptic agents. So student, it includes flavors and colorants that are incorporated into the formulation. Ideally, the ointment should be stored at room temperature rather than at extremely high temperature. Otherwise, phase separation can separate in the emulsified product, which is difficult to remix to yield a uniform appearance. Getting? So that's all, dear students, in our today's video. Thank you for watching till end.